not presented at the ASCO meeting, but surprisingly concurrently, the FDA approved the use of atezolizumab with bevacizumab as first-line therapy of hepatocellular carcinoma as opposed to treatment with sorafenib, which has been the standard of care up to now. And this is based on the IMbrave 150 trial, which was an international trial sponsored by Genentech. In that trial, it required a few things. First of all, patients had to have good performance status, and they had to be Child-Pugh A only. So the Bs, the B7s, B8s that we see normally were not eligible for the trial. It enrolled about 500 patients globally in a 2-to-1 randomization of the atezolizumab and bevacizumab arm compared to a standard of care with sorafenib at the full dose. And the primary endpoints were survival. So the study was conducted over a couple years and presented at ESMO last year with the primary endpoint, the primary endpoint was PFS, and then a secondary endpoint or co-primary endpoint was overall survival with splitting of the power for alpha. And the study was quite positive for survival. The 6-month survival was 85% for the immunotherapy and 72% for the sorafenib, and then the hazard ratio was 0.8 for the survival 18 months with the sorafenib. And then the PFS also had a hazard ratio of about 0.6 with a median of 7 months versus 4.3 months. So for both PFS and overall survival, the study showed a 40% benefit for using the immunotherapy. And it also had a better toxicity profile because it didn't have all the problems associated with sorafenib, including hand-foot syndrome and fatigue and diarrhea and the kind of things we associate with it. One other thing was there was some concerns about bleeding with the bevacizumab in this study, and every patient had an upper endoscopy and was evaluated for varices and treated for some kind of varices within 4 to 6 months prior to starting the study. So that's an important caveat if you use this approach, that you should be aware of the potential for GI bleeding and evaluate the presence of varices beforehand. But all in all, this was really well conducted and very positive study for HCC, proving that some of the early data for use of PD-1 was true, that patients could benefit from anti-PD-1 in later lines, but also that bevacizumab really seemed to potentiate the activity here. So if a patient progresses on immunotherapy up front, especially this combination with bevacizumab, we have lots of TKIs as second line, sorafenib, lenvatinib, cabozantinib. And those will all be options. We just don't have data yet on how patients will fare. And additionally, both cabo and lenvatinib are being combined with immunotherapy in similar phase 3 first-line trials. So we'll know more in the next couple of years about how to use immunotherapy with which partners for first-line therapy.